welcome to the show. Welcome to VA Straight Talk. Today we're going to explore the current services that are provided by the SORCC in White City or Southern Oregon Rehabilitation Center and Clinic and how to access those services. So today my guest is Dr. Margo Funk. Thank you for being with us today, Dr. Funk.
It's my pleasure. Thanks, Andy.
So I'd like to start out with what brought you to the Rogue Valley?
Sure. So I moved from Cleveland, Ohio to the Rogue Valley about 2 years ago. I actually came with my husband who was joining a cardiology practice in town at Southern Oregon Cardiology. And so I was a practicing psychiatrist at the Cleveland Clinic before we moved here. And so I came to the Valley and wanted to keep going in psychiatry. And also I really like to build programs and take programs from one place to an even higher place. So
You're welcome.
That's where I'm-
Thank you for being here.
my pleasure.
First, I'd like to kind of talk about the veterans that the SORCC serves, and just in case everybody doesn't understand, the SORCC is Southern Oregon Rehabilitation Center and Clinics, and Dr. Funk is the Associate Chief of Staff of Mental Health Services. Can you tell us the different types of services, or just tell us our general service area?
Sure.
The veterans we serve.
So at the VA SORCC, we serve a total of about 21,000 veterans. And I think that's something that many people in the community may not know,
Right.
that we actually serve quite a few people in this valley. In terms of mental health services, we typically touch about 5,000 veterans every year.
Okay, and so the bulk of services are provided on a outpatient basis, and that way that's why there's 21,000 people that are actually getting service there. Although when we think of it, we're thinking about maybe the 100 or 200 veterans that are actually residents there.
That's exactly
So,
right.
Yeah, so it's good to get that clear, and so people know just how important that is and what is going on out at the SORCC. When we're talking about outpatient services, can you tell us a little bit about outpatient services?
Absolutely. So we have a progression or variety of outpatient services at the SORCC. And as you can see here, we really start with when a veteran comes into primary care, we have the opportunity for them to see mental health services right away. And a veteran doesn't need an appointment. They can just come in, come to the primary care office, say that they'd like to see mental health, and they can be assessed, they can receive counseling. We have a number of groups within that clinic. And so it's really an easy place for a veteran to enter the system is through primary care. We call that program Primary Care Mental Health Integration, or PCMHI. A veteran may hear that term used.
Okay, so if I just say I live in Klamath Falls and I want to have some services there, but I don't really want to be a inpatient services, but I'm worried about my health. I want somebody to see me or just get involved in the system. Can you direct us to how people who maybe are veterans and haven't had any services provided to them in the past and just want to know, how can I even check to see if I'm eligible for services at the VA?
Absolutely. So we really like to keep that process local so that there's no confusion within the bigger national VA system. So what we like to recommend is to call one of our eligibility specialists. Jack Green is one of those people, and if the veteran calls the main VA number at the SORCC and calls Jack's extension, he can walk them through the entire process.
Okay, thank you. I think that's really important for us to just have a simple way, a touching point where we can find out, especially for the people that we care about. That, like I said, it took me, I was telling Michael, it took me 25 years to decide to come to the VA. And most of that's because I didn't know anything. So that's a way to find that information out and start moving forward from there. So let's talk a little bit about residential care, what's going on inside of the VA there. Can you tell me, I have a question here. I'm going to read some questions to just to make sure that I'm getting across what I want to get across to you, so I have that out here with me. So what is the difference between primary care, mental health integration program that you just talked about, and the behavioral health interdisciplinary programs? I know there are two programs there, so can you kind of...
Absolutely. So if you think about the continuum of mental health services that we provide on an outpatient basis, a veteran can start in primary care and see PCMHI, maybe for depression, anxiety, coping with medical illness or other chronic diseases, working on smoking cessation. But then for veterans who may have more severe mental health problems, such as more severe depression, anxiety, bipolar disorder, schizophrenia, they may be better served in our behavioral health interdisciplinary program, and that's also known as BHIP. It's also known historically as the General Mental Health Clinic.
Okay.
And so in that clinic, a veteran has access to a wide variety of services. They will have case management services where they're assigned to a team, and a nurse who leads that team actually knows the veteran, works with them on any sort of psychosocial need that they may have. They may be seeing a prescriber, so a psychiatrist or a psychiatric nurse practitioner, to get medications for their mental health need. They may see a psychologist or a social work therapist. And then we're actually adding another component, which I'm really excited about, which is a peer support service within our BHIP clinic.
Great.
So I think
You know,
that's
peer
gonna be great.
support's a great place to be and helps out. And I'll try to touch on that a little bit, but first I'd like to kind of talk about what mental health really means. So there's a lot of stigma behind mental health, and people don't really understand what that umbrella looks like, from anywhere from PTSD to anxiety to a sleeping disorder. All those things fall under the mental health umbrella, right?
Absolutely.
So can you kind of let us know a couple other things, or kind of put that in a more general perspective, so that I know that I need to stop smoking cigarettes? Am I gonna have, where's the stigma? Is there gonna be stigma involved in that? You know, so as I hear it from a professional, we can explain how the programs work and how all those fall under the umbrella.
Yeah. So, you know, I think you're right that there does remain a lot of stigma surrounding mental health disorders, but I really like to look at this as like any other chronic medical condition, like hypertension, diabetes, heart disease. Mental health disorders are disorders of the body and the brain that need treatment. And so we approach them in that way, just like you would approach any other medical condition. And our staff really take pride in approaching mental health disorders that way, really to try to reduce that stigma.
Okay, I know stigma causes a lot of issues in the community and with people personally. And I know that there are some guidelines that the VA goes by, some anonymity that happens there, HIPAA rules, so that that information never goes anywhere and people can be secure in asking for help.
Yes.
And know that they're going to be protected and their information is going to be protected. So that's something that I think is important for people to realize, that it's okay to say, can I have some help?
Yes.
And then get the help, and then go get it, and know that whatever's going on is going to be protected.
Absolutely.
There's specialty mental health things that go on. Can you kind of take us through some of that?
So a veteran, you know, may be getting most of their services in PCMHI, the primary care mental health clinic, or in BHIP, the kind of general mental health clinic. But there are veterans that may have more specialized needs. So veterans with PTSD may be referred to our specialty PTSD program. And in that program, we offer a variety of therapy services that are usually time limited. So once you go to the PTSD program, you may not always be in that program. You'll come back to be HIP. But it really offers more intensive treatment to really target that PTSD. Another specialty program we have is the substance use disorders program. And so this is really targeted for individuals with trouble with opioid use disorder, with alcohol abuse or dependence, methamphetamine abuse, really any substance you could think of that might get people in trouble, we help target in our substance abuse program. And one of the cool things about that program is that we also have what we call medication-assisted treatment for veterans who have opioid use disorder. And that's in the form of Suboxone or buprenorphine. And so that's a service that we offer.
Okay, can you tell us a little bit about those two programs?
Absolutely. So the Buprenorphine Program is operated by an interdisciplinary group of psychiatrists, social work therapists, pharmacists, and a nursing care manager. And the role of that nursing care manager is really to coordinate care between everyone on the team. And a veteran who has had trouble with, typically it's heroin, so intravenous heroin use, but it could certainly also be prescription narcotic opioid drugs. We will help get that veteran onto a medication that essentially helps them come off of the heroin to be on a safe medication that is not addictive and can help a veteran get back into functioning life that's productive and where the veteran wants to go.
Okay, so as we talk about heroin and a lot of other drugs, some of those, and I'm just going to get off track and I'll get us back on track in a minute, but I just want to touch on this a little bit. We talk about those drugs, a lot of them are used intravenously, and there's a lot of the community that does it. Certain things are there, and one of those things is hepatitis that happens. And there has been a treatment recently for that I believe has been worked on at the source. Can you kind of cover that with me if you know about that?
I don't know a lot about the hepatitis program, but I can tell you that intravenous drug use is a really huge problem in the Rogue Valley. Okay. And it's something that the VA SORCC is really dedicated to helping from what we call a harm reduction standpoint. And what harm reduction means is that we try to basically prevent death.
Yes.
So death from overdose, death from medical complications of IV drug use, which can lead to very bad cardiac conditions like endocarditis. And so this harm reduction model is one that's kind of gaining popularity, but also has a lot of evidence behind it. And that's something that we're really moving forward with at the source, is that we want to prevent death and harm. And so things like our medication-assisted treatment, like buprenorphine, is something that we use to help that.
Okay, so even though we're primarily at the VA source, they are categorized under a mental health facility, there are ways to other medical procedures and other medical help outside the mental health.
Absolutely.
And that kind of sounds like the whole health model that Michael Weld and I had talked about earlier. Do you have any comments on that?
So just to go back to the other medical services, we really have a robust primary care service at the VA source. Right now there are about 8 what we call PACT teams, patient-aligned care teams. And what that means is that each team has an assigned number of veterans to that team, with one doctor a nurse, some nursing assistants, an administrative person, and they really focus in as a team on the veterans on their panel. And so I think the great part about that team is they get to know the veteran individually, and the veteran gets to know his or her team.
Okay.
And so then they can really focus in on what's important to the veteran. And I think that goes to the whole health model.
Okay. It seems like, and everything I hear tells me that there's really a lot of care going into helping our veterans and making sure that we are giving them the services that they need. What I hear through the media, and we're going to touch on this a little bit because I think it needs to be explained a little bit why some of the stuff is going on, and that is that there's a reason why there are wait times and things like that, especially in our area on certain things that happen. And I want you to, if you would, tell us a little bit about why people have to wait for some services.
Sure.
and kind of give us a relative look at the need compared to people that are taking care of that need.
Yeah.
And that way we can kind of get a good picture of what's going on instead of what we're hearing in the media.
Yeah, it's a great question. Wonderful question. So in the Rogue Valley, we really struggle with recruiting physicians. We are not a well-known area, and typically physicians who are graduating from a training program want to go to the bigger cities. So it may be Portland or Seattle or down in California. They don't know the Rogue Valley, and so they don't know what we have to offer. So it's very difficult to bring them here, and it's often difficult then to keep them here. And so this is really a barrier to veterans getting timely care, and in fact, just folks in the community in general getting care. There are not enough physicians to go around. So if you think back to that 21,000 number that we talked about at the beginning, right now, to serve that many people, we have under 10 primary care doctors.
Wow.
So think about those numbers and how many veterans one doctor needs to see in order to manage all of that care. And that's because it's really hard to recruit to the Valley.
Okay. Is it financial, or what do you think? Is it the finances of it all? Because I know the private industry pays well.
They do. And I can tell you that over the last year, our executive leadership at the VA SORCC have really been working hard to look at what is it going to take financially to bring physicians here.
Okay.
So I think they're very receptive to that piece. I think it's really that we're an unknown commodity or quantity here in the Rogue Valley, and people just don't know what we are. And once they come, then they realize this is a gem.
Right. This is the place to be.
Right.
Okay.
Right.
I'm with you on that. So I just wanted that piece to get out there. I don't think people are generally thinking along those lines, especially when they're angry or the media is feeding this story but not really qualifying what's going on and why it's going on. So I'm going to move on to the next question here, and that's going to be access to urgent mental health care, veterans that are in crisis. Can you kind of go through that with us a little bit?
Absolutely. So thinking back to your conversation with Michael Weld, we at the VA SORCC are not a hospital, and we don't have an emergency room. And I think that's something that the community sometimes doesn't know. So if a veteran is in acute mental health crisis, there are a number of things they can do. One would be to present to a local emergency department. One would be to call 911. Veterans can also call the Veterans Crisis Line, where they can speak to a person immediately to help them walk through the crisis and strategize what's the next step. For veterans who maybe aren't in an acute crisis but have urgent mental health needs, we do offer same-day access services as part of our BHIP clinic. And what that looks like is any veteran can walk in on any day between 8 and 4 p.m. And first they'll be seen by a mental health nurse or a mental health social worker who will talk to the veteran about how can we help you today? What's the mental health concern? And they really try to strategize what's the next best step. If the veteran needs a medication, then they can be seen that same day by a psychiatrist or a psychiatric nurse practitioner. If they need to go to an inpatient psychiatric unit or a medical hospital, then our team can also facilitate that and make that happen same day. And so it's a wonderful service, and we really welcome any veteran who is in need of acute mental health services to come in.
It's very important for us as veterans to know that, and for family members to know that that's available just in case, and normally something does happen or we wouldn't be so involved.
Right.
So we need to know how to get through that and how to deal with that. So my next piece for you is, and I kind of covered this with Michael Weld in an earlier episode, and that's the VA in White City has long been known as a DOM. From when it was a domiciliary housing hundreds of veterans. We learned the history of the DOM from Michael. So how is it different now? So he took us through from 1941 as a military installation and brought us up to, they transferred over to the Department of Veteran Affairs, to a domiciliary, to a kind of treatment center. But today, it's even moved a little further. Can you go through what it looks like there today?
Absolutely. So today we have a residential facility with right now about 230 operational residential beds, with the long-term capacity to operate at about 366. Right now our focus is really to reduce barriers to veterans getting care. And so as Michael talked about in the earlier episode, we've kind of looked at our processes and really tried to hone in on what were the things that were still getting in the way of us treating the population that really needs treatment. And so we've identified kind of 3 populations that we can best serve at our residential facility, and that's veterans with any sort of mental illness, whether that's depression, PTSD, or a primary psychotic disorder like schizophrenia, veterans that have a substance use disorder, and that could be anything like what we talked about earlier, and then veterans who are experiencing homelessness. And it can be any combination of those 3. And so what we want to do then is to bring that veteran in and, based on their needs, create an individualized treatment plan. And I think this is one of the things that's new that we're doing. You know, in the past, we had different tracks that when a veteran was admitted to the program, they would go into a track and they would stay in that track, and when the predetermined length of stay was complete, they were discharged. And now what we're really looking at is what is the need of the individual veteran, and how can we tailor their residential experience to the needs that they have.
Okay, this being one of the largest facilities in our country, can veterans from different parts of the country still come and have services there?
Absolutely.
And how does that kind of happen?
So typically what happens is an electronic consult through our electronic medical record is placed from the outside facility. So wherever that veteran is now, a clinician will place that consult, and that will come to our team. The consult will be reviewed, and then when that veteran is accepted, we will reach back out to whoever placed the consult and the veteran and offer an admission date.
Okay.
So that's the way we like admissions to happen. We do, though, still have the capability for a veteran to walk in the door of the facility and present themselves and say, I would like admission to the facility. And typically we don't admit veterans on the same day. We do like to honor the list of consults that have already been placed. But then that veteran would be placed in line for admission.
Okay, I know that the admission process was really difficult at one point, and that sounds like it's really turned into something that's more friendly and more accepting of the people that are walking or looking for help. We're down to about a few minutes. I hope we still got a few minutes, so I would like to give you this chance to kind of put out there what you'd like to say, or just wrap up, or even just take us through what we've heard from you so that we understand it a little bit better.
Absolutely. So Andy, I think one thing that we haven't touched on, but that's really important to note, is that the latest statistic on veteran suicide is that about 20 veterans per day commit suicide. And this is alarming and something that we really want to actively fight against. What we know is that about 14 of those 20 veterans who complete suicide, 14 of them are not getting VA services. And if we can outreach any veteran who's not involved in the VA system, then we can provide really comprehensive mental health care for that person. So we really want to encourage veterans to reach out.
Okay, thank you. We're going to wrap it up right now. I'd like to thank Southern Oregon University. We're going to, just give me a second. I'd like to thank Southern Oregon University for their support of RVTV Voices, Rogue Valley Community Television. You can watch RVTV Voices on Channel 15 and Channel 115 on Ashland Home Net and Channel 182 on Charter Spectrum. To find out how you can become an RVTV producer, contact Charles Douglas. Thank you to the all-volunteer crew for making this show possible, and thanks to you all, the viewers, for watching. I'm Andy Draper. We'll see you the next time.